Welcome, panelists. Let me do a quick introduction. So we have with us today from the Pharmapreneur Academy, Blair Thielemier. Also from RX Clinic Pharmacy and the founder of the Avant Institute in Charlotte, North Carolina, Amina Abubakar. Sorry, lots of tough names this time around. And then from Valley Integrated Pharmacy in Bedminster Township, New Jersey, Jim Cammarata. So welcome, panelists. Sorry, we're doing this a little differently. We had some technical difficulties, but it's great to have you here. And I want to start off by congratulating Amina, who was the 2020 NCPA Pharmacist of the Year and awarded that in October. So congratulations, Amina.
Thank you.
Okay.
Congratulations.
So welcome, panelists. When we talk clinical services, we're really talking anything beyond dispensing. And that's a really broad topic. And Pam just, I think, gave you a really nice presentation to lead us into this panel. So one of the questions that came in during that panel was, I'm brand new, where do I start? So we're going to come back to that and get your opinion on that. But let's start by what's your take on what are you doing in your pharmacy for clinical services? So Amina, let's go ahead and start with you on that topic.
Sure. So we have focused on, as you said, anything beyond dispensing. And we looked back to see how many activities or interventions that pharmacists do every day that we take for granted. And by understanding that that's actually valuable on the medical side with medical providers, with accountable care organization. So our clinical services are collaborating with physicians to offer chronic care management, remote patient monitoring, behavioral health integration for their mental health patients, and annual wellness visits at this time.
Okay. And Jim, let's get your take on what you're doing, maybe some of the same things and some different things.
Well, we are highly non-traditional. So I've owned Valley for 30 years. 7 years ago, I converted my pharmacy to an integrated pharmacy because my belief is functional medicine and getting at the cause of the disease instead of treating the symptoms. So our entire emphasis is simply assisting patients in finding out certain problem areas where we feel a lifestyle change and a nutrition change can significantly impact their overall health and wellness. So we are heavy from the nutritional aspect. I have two nutritionists, also a naturopath on staff, although it's kind of reduced during the COVID year. And we do a lot of clinical testing to arrive at the causes of certain conditions such as IBS, a lot of gut situations. We do bioidentical hormone therapy. And we also, one of our flagship tests is micronutrient testing. So you talk about drug nutrient depletion, but even though certain drugs deplete certain nutrients, you're still guessing at what's going on. Well, we don't like to guess. We actually encourage patients to test their micronutrient panel, which is a collection of 34 micronutrients. Those are nutrients that you do not get in the standard blood panel. And then we address their needs both through diet and supplements to address those areas where they're deficient or depleted or what have you.
Okay, very interesting stuff, and kind of two different takes or that build off of each other. Blair, you teach this stuff, the question came in from panel or in the last discussion. Question came in from one of our viewers on what do I do first when you're teaching? What are some of the low barriers to entry areas to get into?
Yeah, absolutely. So what Amina talked about was really what, we call the physician collaborative path. What James is talking about is really the functional medicine, health and wellness, cash-based path. But what pharmacies can do to take advantage of that low-hanging fruit is really look at what services they are already doing. So like Pamela said, Are you already doing MTM? Are you already doing vaccines or certain point of care tests? And then looking at what state or what does your Pharmacy States Practice Act say that you can do? So, we all know that different states have different regulations around what pharmacists can do, and provider status varies. What pharmacists can do to begin offering these clinical services is look and make sure that they have implemented every possible service that they can that the state's Pharmacy Practice Act says they can do. If there's blanket collaborative agreements in place in the state through the health department, for example, make sure you have those in place, and then start deciding which of these new programs really align with your passions and your patient demographic, what your patients are looking for, and figure out which services really align and are complementary to the services that you already have existing in your pharmacy.
Okay. Well, and going back to Pam, one of the things that when she was talking about this, one of the things that I thought really stuck with me was make sure you do it well. You only get one chance. And I think that makes tremendous sense. So when let's start with you, Jim. What are the most popular services that you really do well and that people are asking for? What do you see in your pharmacy?
Okay, so I failed to mention we're also a compounding pharmacy. We have a significant compounding business, and that's related to bioidentical hormones. So our flagship testing, the first one is a micronutrient, which is a highly successful test. It's great because it not only addresses drug nutrient depletion, but depletions due to dietary situations. And it leads to supplement sales, which is nice because you're actually helping the patient and you're also accessing a profit center. So it's a win-win. We do a lot of gut testing because the gut is the source of a lot of morbidities in the United States, metabolic syndrome. I could go on. I don't want to go into the list. And then on the bioidentical side, we do a lot of testing there. And myself and my compounding colleague, Bernie Kowaleski, we're highly educated in bioidentical hormone replacement therapy. We've been doing it for combined 40 years. And so we also use that, and I'm very passionate about that. So is he. So I hope I answered the question. I'm getting a little sidetracked. But I do want to say that focus is eminently important and passion is eminently important. You got to be passionate and you've got to be focused. If you combine those two with enough energy and a little bit of dollars and effort, you cannot fail.
Okay. Yeah. And the whole passion thing, I hear that all the time. And of course,
it's very important. Yes.
Yeah. Well, and that's actually the reason we're doing Climb is my passion for pharmacy. I've been around it my whole life. But Amina, let me take the same question to you. What are your most popular services? What are you passionate about? I guess we'll add that too.
Our most popular is the care coordination for chronic care management and remote patient monitoring. So this gives us that extra touch during MedSync to be able to get data from a patient's device, like their blood pressure or their scale. And when we make the MedSync calls to have appropriate interventions for both patients and the providers. So the ongoing touch between office visits has been our focus, that our whole team gets to engage, not just the pharmacist, it's the technician, it's the cashier, it's the driver, everyone feeling that we are connected to serve the patient between their office visits.
Okay. So that interaction, let's talk about how that's been impacted. And we'll start, I'll continue, let you continue. With COVID-19, what's the impact? Is there new opportunities? What's the impact of COVID-19 on your services?
So COVID-19 actually accelerated the partnerships because the first thing that happened is patients stopped going to their doctors. If it wasn't an urgent need, so they were not going for their routine visits, but they would call the pharmacy to ask us to get prescriptions. They'll say, call my doctor to get my blood pressure medicine. So we were able to actually set more partnerships with physicians, telling them if the patient isn't able to come to you, we can now establish chronic care management and remote patient monitoring. So one, we are touching the patient, we're giving you the data you need to make clinical decisions, but also they steal revenue. So we get to share the revenue with the providers. So yeah, I feel like they need pharmacists' help now more than ever because their lobbies are still closed.
Okay. Jim, how about for you? How's
Okay.
COVID impacted?
Well, it's interesting. But first of all, I want to make a comment. I think it's wonderful what you're doing. And I think so many pharmacies can do that. And I think it's so absolutely necessary that even transition to care or connecting or somebody holding the patient's hands. We find when we do consults, we have to hold the patient's hand a lot. And that's one of the difficulties we have is the patient, unfortunately, is usually the complicating factor. So as far as COVID, it did change our model because we did have I have a consult room and we used to have patients come in and consult, and we've been doing it via Zoom, but it's impacted us unfortunately negatively that way. As far as we are now, so it's interesting you asked that question because up until now, because we're integrative pharmacy, we have a portion of our community that is vaccine sensitive, I'm sorry to say. We decided not to do flu vaccines because everybody was doing them. Well, I've now flipped. I just recently got certified. I believe vaccination is hugely important. I've always believed it, but now I think more than ever. And we're going to become a vaccination center, not only for COVID or flu, for people that travel. That's my next goal in 2021 is to launch a very significant vaccination center at Valley Integrative where we become experts and we are the go-to. So that's one of my goals for this year. And I'm actually hiring a pharmacist that is very good at that to assist me and my other staff.
Okay. Well, Blair, do you have anything to add? And we don't have to talk about COVID because, you don't have a pharmacy per se, but let's talk a little bit about the things that Jim just talked about with vaccinations. What do you happen to know what percentage of pharmacies are doing vaccinations? And is that an area where people really should be getting involved?
Yeah, I think, going back to the COVID, I think that it has caused a lot of disruption in healthcare, which is creating opportunities for pharmacies to kind of step in and offer these advanced clinical services like vaccinations, like point of care testing. I'm not sure what percentage of pharmacies are giving vaccinations currently. I don't have those numbers. But what I am seeing throughout the market is trends for using remote and virtual type services. So lots of pharmacies are still doing the appointment-based model, but shifting to a virtual appointment. Or like Amina said, they're able to offer chronic care management or remote patient monitoring as a remote service. So those can be offered under the general supervision of a physician, which means a pharmacy can, contract with them and work remotely to be able to serve those patients. So telehealth, I think, is probably here to stay. That's one thing I've really seen throughout the pandemic is, before telehealth was something that you might have an acute care visit with a physician, across the country that you're only going to talk to that one time. And now we're seeing PCPs using telehealth. And, I'm excited about that. CMS seems to be promoting telehealth more and more. So we'll continue to follow that. But to me, it looks like a really great opportunity for pharmacists to step in during this disruption caused by COVID and really be able to leverage our knowledge and, help our patients more than we have in the past.
Absolutely. So let's telehealth. Just out of curiosity, Amina or Jim, are you doing telehealth today? Either of you?
Yes, I think telehealth has become a mainstay, and I call it telelocal because now the primary care doctors that patients used to go see are the ones on the video chat with the patients. And so then our pharmacists get to do co-visits with those patients on the visit. A prime example is back in the days, the patient will call for a refill. You'll send the doctor, they'll send a refill back, but no one got paid. The doctor didn't get paid, neither did the pharmacy other than the prescription. But now when a patient initiates that refill and we have the vitals remotely for their data, we can schedule an office visit for them to get the refill and get the revenue back to our local doctors. So I see telehealth and telelocal like emerging in a very big way.
In our environment, excuse me, I'm sorry. In our environment, basically the telehealth we're doing is our consultations with patients with our practitioners. So if we have a nutritionist or our naturopath, it's via the Zoom consult where it used to be in person. That's the extent of telehealth.
And then when you, again, like what Jim says, so our pharmacists have moved their diabetes education on a group Zoom call now with the patients. So so this has nothing to do with physician collaboration, but these are patients who you are serving under Medicare for diabetes education. So using the telehealth platforms to do that, and also the Medicare enrollments, because some patients needed to still have that face-to-face with a pharmacist. So we were able to move some of those general meetings with the patients online.
Yeah, I have to think telehealth is here for good. And Amina, you and I were talking yesterday about, one of the things the Affordable Care Act did was it really changed our focus to, instead of a fee-based system, to really an outcomes-based system. And I think what I'm hearing today is, and have been, hearing for a while now, is this is really pharmacy's opportunity to get involved and help improve patient outcomes. And that's, of course, what we're trying to do here at Climb, is to provide pharmacies and pharmacists the knowledge to do that. One of the questions, though, that continues to come up, and it's a question that just came in, is, how much money am I going to make any money on this? I've got a limited amount of time. I've got a limited amount of resources. Am I going to make any money? So, Jim, let's start with you. What are your thoughts?
And financial return on such paths I've taken? Is that the question? Yeah. Basically, okay. For us, I have to say, a lot of our sorts of cash business, which is wonderful. So, because it's a wellness, and the problem with our medical setup now is that we still are not at the point where we're paying for wellness. Hopefully someday we'll get there. Disease prevention as opposed to disease treatment. So a lot of ours is cash based, but I find there's a significant amount of patients out there who want to be healthy and well and are actually willing to pay for it when they see what can be accomplished. So there is financial reward there. You have a little bit. We have more control over it because we can decide what our pricing is, and we provide our services on for mostly a cash model. Now we deal with a company called Vibrant. Most of our testing, we do 3 labs, but our majority is Vibrant Wellness / America. The America part is the paid labs, and the wellness part is the unpaid cash to the patient. And so we use a mixture of that. The food sensitivities and allergies are covered by most insurance companies. The gut testing, where we test for wheat sensitivity and gluten sensitivity, is all cash. That comes under the wellness umbrella. But we do both, and we do well because of we get a modest payment for the testing and a modest payment on the consults. Where we really do a significant return on investment is the supplements we sell. Because once you come in and you give a patient a consult and you show them where they're clinically where their situation is deficient or their nutrition is deficient, they are willing to supplement. They are engaged and they're willing to put some money into that. And so that's where some of the return is for us presently. On the bioidentical side, very quickly, we do testing with ZRT, and then we do the compound. We will refer to a physician, and typically that physician will send us a prescription back, and then we have a very nice return on investment on the bioidentical hormone compounding side, there's a significant margin on that side. That's also, for the most part, a cash business.
Okay, great. Thanks, Jim. Amina, how about that question back to you?
Sure. So since we've been doing this for over 5 years, I'll tell you maybe the first year and a half we lost money because we were trying to figure out our way. So we hit a lot of roadblocks and we didn't really understand the intricacies of setting up these services and relationship. But now looking back at our last few years, our business has shifted. We're very low volume in prescription. So our revenue is actually 70% is from services and 30% is from prescription. And because we had to take advantage of what was a low hanging fruit, we were in a low income area. So most of our patients are Medicare, Medicaid. So the Medicare services for population health, like the obesity counseling that Medicare pays for with no copay. So we had to build upon what we have. And we didn't realize there were more of those patients in our communities, in our doctors' offices, and that became our main business.
Kudos to you, by the way.
I'm sorry?
Kudos to you. I applaud your efforts.
Survival trick. It was because I really was bad at wholesaler math and trying to make reimbursements make sense to me. I fought with my accountant every day to be like, what do you mean? Where's the money? And so finally, since pharmacy school, I've had a passion for patient care, patient interaction services. So it just happened. And passion, persistence, never afraid to fail. We can fail 10 times, but we're going to have to figure it out.
You can make money in high income areas and low income areas. The approach has to be different, but you have to realize what your demographic is. I happen to be in a high income area, so I did what I did because of passion, but I also realized what the market was. In your respect, you have an environment where you can get paid by Medicaid services for what you do, which is extremely important. And there's an income stream there. And just because you're in a low income area doesn't mean you can't do something. In fact, sometimes your opportunities are actually better. Yeah.
Well, I mean, I'm pretty sure that you're not the only one that can't figure out the reimbursement math. Maybe just the insurance companies know how that works. Blair, so you actually mentioned it, looking, and Pam mentioned it as well, looking at your environment, and Amina and Jim just, both just commented on that. So you have anything to add to that? Expand?
Yeah, I think that looking at your demographics, so I've heard pharmacists say this clinical service won't work because I'm in an urban area. And then another one will say this clinical service won't work because I'm in a rural area. And, people are making it work every day. So we've got two great examples of pharmacy owners here who are making clinical services work. And what I'm seeing is pharmacy really needs to shift from this product-based business model to a more service-based centric business and practice model in order to, continue to not only survive, but thrive in the future. And, part of that is, I think, the preventative type services that we can offer, and figuring out, how to attract new demographics of patients. So if the patients you have coming into your pharmacy aren't those that are interested in a cash-based service, for example, trying to figure out what niche can you put in place? Where are the gaps in the community that you could put something in place like a health and wellness program that people are looking for and people would be willing to pay for, and figuring out how to attract that new demographic of patients into your store.
Okay, and unfortunately, we could do this for. I would love to have done this just for an entire hour. We could do this. I'm sure all of you could talk about this for hours and hours. And we're about 7 minutes over now. There's a couple of questions that came in, but really I think we need to wrap up. So I'd like to just ask this to each of the panelists, and we can start with you, Jim. So, what would you say to somebody who is just wanting to get started? What advice do you have for them?
Okay, I'll answer that question, and I have to make a quick statement in regards to drug depletion. So please bear with me.
Absolutely.
I would say to you, do what you're passionate at and focus, commit, and just do it. But the passion is very important. And there's enough out there. There's enough clinical services you can provide. I knew 10 years ago that clinical service and billing services was the drug product was dead 10 years ago. It's only been proven over the last 10 years. And what I want to add is, I know, Brad, you're doing, and first of all, I want to thank you, Karen, Blair, everybody at RMS, tremendous company. We went with you in July. One of the best moves I made in my 30 years of business, by the way. So I love you guys tremendously. You saved us, but I won't go into that. What I want to say is you're doing a drug depletion module, which I think is critical. And I said this to you, Brad, the other day. You have to make it very easy for pharmacists because they're so scattered and so schizophrenic that you have to make it easily executable. I actually tried to do one myself about 4 years ago with cards, and I did all this whole thing, and it never worked because it wasn't executable instantly. If you guys could come up with a software solution that makes it, you have this drug and here's the depletions and blah, and makes it very simple. If you can have a software solution for that, you can team up with orthomolecular products. Orthomolecular is one of the nutraceutical companies that supports pharmacy but more than anyone else. They're our major vendor. I deal with about 20 different nutraceutical companies. Orthomolecular is number one. They love pharmacy. They help you. If you tie in with them and get that going, you can help a tremendous number of pharmacies, just that alone.
Well, thank you. Thanks for the kind comments. I really appreciate it. And I will talk to you about that because we actually do have an interface to orthomolecular, and we do, Pam from TRC Healthcare, we have an interface to their nutrient depletion module. So appreciate bringing it up. And we think drug-induced nutrient depletion, we've had multiple discussions about this in previous climes, and we think it's really low-hanging fruit. We hear from the pharmacies that are doing it. They're making a lot of money doing it. So,
and all you have to do is do a micronutrient testing at your store, and you back that up, and you take it to the next level, and then you add that.
Well,
that's simple. That's pretty simple. Yeah.
And I appreciate those kind words too.
Mm-hmm.
So, Amina, what would you like to say? And also, and please mention the Avant Institute as well in your closing.
So in my closing is that pharmacists need to be in tune with what problems exist in their community, because people don't buy products, people buy solutions. For example, my husband, my brother will be great customers for Jim because they always go to these vitamin stores and they tell them how they can gain more muscle and they can solve these problems. And my husband comes back home with a bag full of supplements, and that individual, a 20-year-old, is not a pharmacist, did not ask my husband or brother for any underlying medical conditions. But pharmacists have this knowledge and we shy away because we're afraid to sell. We think people don't want our services, but people are spending. They're spending in these places. So I've always said it's the solution that we don't know how to articulate and convince people they have a problem. My CPA, my mechanic always tells me I have a problem when I take the car. So I think that mentality is important for a shift. And and just keep learning, not every services is good for everyone. Don't do things that you don't like or you wouldn't sell or you wouldn't use yourself, because it becomes a very disconnected way of selling. Mm-hmm. So if you're not in it, don't do it, find something else.
Okay, well, thank you very much, Amina. And Blair, go ahead and I'll give you the last word here.
Yeah, I think to build on what Amina said, pharmacists, we have to believe in the services and programs that we're offering. So, above all else, believe that you can make a difference in your patients' lives. And wherever that passion is, it could be diabetes, it could be pharmacogenomic testing, it could be bioidentical hormone replacement therapy. Whatever it is, make sure you believe in the program that you're selling. It will make it so much easier to sell it, to market it, and to really make sure that it's a successful program. So, Jim also mentioned pharmacists can be kind of schizophrenic. There's so many opportunities that are out there and available. it really is difficult to focus. So what we've done in the Pharmapreneur Academy is create the 3 pharmapreneurial paths, which are the physician's office-based path, the pharmacy-based path, and then the patient pay path, which would be primarily cash-based services. And following one of those paths kind of helps you put your blinders on and focus on the one direction that you want your program to go. Not to say that you can't build out other programs, but you can figure out which direction you want to start with so that you can develop a program that's successful and has, a really good foundation, and then you build out other clinical programs that align with that successful program. And that's how you build your clinical offerings. So we really try to encourage pharmacists to not only believe in their services, but focus on that one program until you can get it successful, until you can get it up and running, and then look to build out your offerings.
Okay. Well, thank you, all 3 of you. Really appreciate the insight. Thank you for participating today. I would love to invite you back, and I'm sure I will invite you back in the coming months to maybe focus on some things that you're doing. But it was really informative. I'm really happy to have you. Thank you very, very much, and Happy New Year to all of you.
And thank you here. Our pleasure. Thank you very much.
Thank
Take
you.
care.
Okay, bye-bye.